Thank you for coming.
Hello,
Yes.
Chairman. Pleasure meeting you, and thank you for having me.
Yes, it's so interesting what you are doing in the US. Maybe you can tell us a little bit how started your work in the US with laser therapy.
I got interested in this in the early 1990s
1990s.
when we were treating patients with bone marrow transplantation and myeloablative therapies, basically chemotherapy that would wipe out their bone marrow. And regularly these patients had severe mucositis in grading it to be grade 3-4 mucositis from these heavy doses of chemotherapy. Some of these patients also received total body irradiation, which contributed even more at their mucosal toxicity. So there are numerous toxicities of these treatments, mucositis being one of them, which basically stopped patients from eating, put them in a very uncomfortable positions. They went into malnourishment, and there were significant problems with that. So in the 90s, there was no treatment for this whatsoever. Now we have one drug for this, which acts only for specific groups of patients, but at that time, there was absolutely nothing. There was some evidence at that point that laser light would contribute to wound healing and perhaps wound prevention. So the idea came that perhaps we could use laser preventively or PBM preventively to avoid this side effect. And we designed what ended up being the first study in the United States that used PBM for prevention of cancer therapy-induced oral mucositis. And we used, at that time, there were no diodes, so we used a real laser. We used the helium-ion laser. Helium, yes, with a 632.8 nanometer wavelength. And we used it on the bone marrow transplantation patients, and lo and behold, we showed significant results. We were able to reduce mucositis significantly in the patients that received therapy. We used a split mouth design, so patient was his or her own control, and the side of the mouth we treated had no mucositis, the other side had rip-roaring disease, yes. So from that point on, once we had proved the concept, I went on to study the cellular mechanisms and to also answer the problem, which retrospectively we should have answered first: are cancer cells being protected by the same mechanism?
Okay, very.
So then we went to some in vitro studies where we compared, since we were interested in bone marrow transplantation, we compared lymphoblasts with cancer cells.
Yeah.
And we found out in vitro that actually there was a differential effect. And the cancer cells became more sensitive to radiation therapy, whereas normal cells were protected. So
the effectivity of the modification was damped to the
was basically a dichotomous response, basically, which we now know. At that time, we didn't know much about the mechanism, but we now know that the response of a cell is mostly due to its oxygenation and stress state.
Yes.
So
yeah, the metabolism was, yeah.
Correct, the redox potential of the cell, correct. So now we understand that cancer cells have a completely different redox than normal cells. So this is what bears the results that we got at that time in the early 90s. And now I just presented at this meeting a study we've done in animals, which are an orthotopic animal model. That means that we took human cancer cells in immune-incompetent animals, and these cancers behave for all intents and purposes in the animal the same way they behave in humans. So we exposed them to laser therapy and then to radiation. Wanted to show that there will be no protection of the cancer cells, and we did. We would have loved to show some sensitization of the cancer cells. That
Great.
was our hypothesis initially. We were not able to show that, but we showed that there was no protection.
No protection.
No protection. So that's one, you know, we're
Congratulations.
we're good. We can apply this for mucositis without fearing that we're protecting the cancer. Yeah. Exactly. The last thing we want to do is protect the cancer.
It's a great research. Thank you.
Yeah.
It's
well, thank you.
Helpful.
Thank you very much. Yes. So the future, hopefully, will be able to use an animal model that has some immune system and show that we can do sensitization of the cancer cells again, such that we can reduce the cytotoxic therapies. So we're looking at the potential of combinations of chemo, radiation, perhaps immune therapies with the PBM and hoping for some synergistic effects. So this is what we're planning to do from here.
And this seems, how do you think the prevention effects that we should make some studies for series that we use laser for prevention to fight against cancer?
I think the data on prevention of side effects is robust.
Okay.
The data on prevention of cancer we know almost nothing about. So could we do that? I don't know, but certainly it would be an extremely interesting area to study. The effect of PBM is, as far as we know, mostly on the mitochondrial membrane. We know there are other effects as well on the cell membrane, on the nuclear membrane. They just have not been adequately studied and described. Would these be able to prevent the type of mutation that produces cancer? Perhaps. We need to also realize here that we don't know exactly what produces cancer. We know in very few cases the whole process of carcinogenesis. So
complex.
Exactly. So it would be a little bit of a shot in the dark right now saying that we would use PBM to protect cancer. Absolutely worth trying. I'm pretty sure we would have a hard time identifying the mechanism by which this protection occurs.
Yeah. You mentioned where we were?
Yes, that it would be a shot in the dark to attempt to prevent cancer with photobiomodulation. I think is well worth trying. Yeah. I don't know what the possibilities are there. Yes. We should definitely look at that. For now, I'm more interested in sensitizing the cancer cells. But again, cancer is a very heterogeneous series of diseases. We're talking about some 1,000, perhaps 2,000 different diseases, which we call cancer. Exactly. Yeah. All of them with different mechanisms of development. So, can we protect the nucleus and the genetic material with photobiomodulation? It's very likely. I would say I think that photobiomodulation is a new frontier in medicine. And we are just beginning to scratch the surface.
Yes.
And I hope that the more of this conference type will occur, the more people will be convinced that we're not talking about snake oil, which is something that we encounter a lot. The more we are able to show mechanisms and results, the more people will be on board, and there will be more investment of time, forces, and money into this type of research.
Understand more the mechanism.
Exactly.
More within the targets.
Exactly. At which point we'll hopefully be able to show some preventive power for cancer. But right now at this meeting there was nothing on that topic. Okay. Hopefully there will be something in the future. Yes. However, my job, I think, in the future will be to show that we can sensitize cancer cells such that we can reduce cytotoxic therapies and their effects. Yes.
By Lasertherapy.
Correct. Yes.
Thank you so much. It was very, very interesting.
Pleasure talking to you.
Just seeing the future.
Thank you. Okay.